Business leaders know the future is already here. The economy is shifting. Non-humans are entering the workforce. Nothing feels certain. SHRM understands those evolving challenges, both in the workplace and the wider world. In this podcast, we'll bring together authors, researchers, executives, and non-traditional experts to help you take on the challenges others haven't yet considered. Because you don't need to be a futurist, you need actionable insights now. You need to be a Tomorrowist. I'm Jerry Won. Welcome to Tomorrowist, where we explore the trends shaping the future of work. As healthcare costs rise and employee expectations shifts, leaders are asking, how can wellness become a true business strategy, not just a benefits line item? From food as a medicine to preventative health, companies are rethinking wellness as an investment in performance and long-term talent sustainability. Joining us to explore this shift is Ben Isgur, Vice President of Thought Leadership at Fidelity Investments. Ben, welcome to Tomorrowist.
Thank you, Jerry. Glad to be here.
We were joking before we started recording that you are Ben, I am Jerry. And so anytime there's a Ben and a Jerry, we talk about ice cream. And so the conclusion of today's episode isn't going to be eat as much as ice cream as you would like and have that be the thing that you will solve all your healthcare costs and your healthcare concerns. But I'm really excited to have this conversation because healthcare, access to healthcare, preventative healthcare, how we live, both related to work and just in our own daily lives, are some things that impacts us all. And frankly, I think it's something that we don't often think about. Healthcare, depending on where you are and how you access it, sometimes seems to be only a reactive thing and not a preventative thing. And so really excited to lean on your decades of experience from a variety of different industry and professional angles to really help us, point the tip of the iceberg to wherever people need to get to help their employees and their organizations become healthier, both figuratively and literally. Well, let's start here, Ben. As organizations navigate rising costs, tight labor markets, new employee expectations, and there seems to be a whole slew of new things that are impacting both the micro and the macro of how we operate businesses and live our lives daily. Why should business leaders think about workforce wellness as a part of their business strategy, far beyond the dollars and cents of a balance sheet?
Yeah, look, I think there's a couple of reasons, Jerry. One is we hear a lot of employers talking about, rising healthcare costs. In fact, really rising healthcare costs are typically an evergreen issue. But benefit leaders have to make a decision. Are you going to put more cost onto your employees through more cost sharing, or are you going to try to find a way to actually reduce the overall health spend? And I think when we think about wellness and prevention, it's one of the few things we can point to that's actually a positive in terms of how it can both reduce costs, but also do it in a way that it's not affecting your employees negatively. So I think that's one reason. The other two that I would just bring up are, for an employer, you're really thinking about your absenteeism, you're thinking about your presenteeism. You want your employees healthy, you want them productive, you want them on the job. Wellness and prevention has a huge role to play in that. And then the third thing I would bring up is, listen, there's a lot of organizations out there. They want to celebrate their culture, and they want to have a culture that is focused around health and around, these positive attributes, and in having a wellness program, thinking about the type of, food and nutrition that employees have access to, that can be a really important part of, improving the overall workplace culture. So to me, those are the big three. It's where else could you have an opportunity to reduce overall health costs, improve your, improve your worker productivity, and increase this positive culture in the workplace.
I love that. And I think, when we think about the cost of healthcare, it is not a simple black and white conversation, right? There are direct costs. There are, things that we are seeing in the news of, are we paying more because it actually costs more? Where's the money actually going to? And broadly speaking, what is the government's role in making sure that healthcare and pharmaceuticals are affordable to a certain degree? Who pays for what? And there's never a simple or an easy conversation when it comes to this. One angle I want to explore with you is the horizon of investment that employees or employers are thinking about, right? And so when we think about making somebody healthier and decreasing absenteeism, which has a direct financial benefit, there are direct healthcare costs. If I have to go get surgery versus I can avoid surgery, that's obviously a benefit. But when we think about from the employer's perspective, well, is Jerry going to be working with me or for me long enough for me to quote unquote recoup those investments that I'm making in his health in the way of paying for my gym membership or giving me a credit when I go get my annual checkup? How do you have that conversation to make sure that at the end of the day, somebody's health doesn't just become a P&L conversation, but there's also care and just an intangible benefit to me as an example, getting healthy as a part of that?
Well, Jerry, I think that's a great question. And I tell you, the number one kind of issue that I hear being brought up by not just the benefit leaders, but really the C-suite. This is part of that CFO conversation. And I think one of the things that you're driving at with this is that question of like, well, is there going to be a return on investment? Why should we invest in this kind of concept of prevention and wellness? Yeah, I think one of the answers to that is, you don't know which of your employees are going to have health issues or medical issues. But one thing that we do know for sure is about 20% of your employees are going to affect about 80% of your overall health costs. And that ratio keeps going, right? With 10% are almost 90% of your health costs, so forth and so on. And what I always say to benefit leaders and organizational leaders, company leaders is, you may have turnover. And so you don't think, well, they may not be with me forever. Why should I invest? But you don't know who really is going to be with you for the long term. And it's often a small percentage of employees that are driving a lot of that cost. And so therefore, it really is in your financial interest to try to keep people healthy, keep people productive, and reduce cost. And I think, I alluded to also the keep people healthy because of productivity. So regardless of turnover, your workers, your employees, they're there right now, every day working, and you want them to be healthy. You want them to be focused. I'll give you a great example of something that we saw in our research that I think every benefit leader needs to think about. About 40% of benefit leaders said that rising costs are actually limiting their ability to do things like pay raises, to provide, more enhanced benefits. And they're even saying it's starting to affect the business itself. So the productivity means a lot in terms of making your widgets or providing for your customers. They're inherently interconnected.
We've had a conversation on Tomorrowist with a lot of folks who are thinking about the demographics of the workforce, right? And so one topic that we often talk about are the generational, and then we stereotype way too much, let's be honest, but we make generalizations about what the older workforce or younger workforce or, the entering workforce expects or even demands of the employer that shifts with our times of how things are. The other impact of the changes in generational work shift is that people are working a little bit longer, right? And so again, there are some varying and changing and evolving healthcare concerns if your workforce stays with you longer or they are coming in younger. And then so on both of the on both ends of the spectrum, then if we're thinking about the trends of workforce evolution or change, how does that impact this conversation on investment in people's health as a business strategy and as a competitive advantage even?
Well, I think it actually affects it a couple of areas. I mean, certainly one is on the strategy side, as you mentioned. I think the other is on the kind of down the weeds on the tactical implementation side as well. So if we take it back up to the highest level, we know that different generations in the workforce have different needs. And by the way, those needs, they change over time. So a lot of things that your older workforce is dealing with, well, your younger workforce will deal with those same things too as they get older. But there are still there's some generational differences there. And I think there's some obvious ones. I think, we often think about like the younger generation is, very comfortable with virtual care, virtual mental health, for example, things of that nature. They also have a different definition of what they consider healthcare. So when we run surveys of employees across the nation, nationally representative samples, our Gen Z employees, they say things like healthcare is a gym membership. Healthcare is wellness. they're not always thinking about healthcare in that very standard way of what is our plan, who is our carrier, how do I get care that way? They're thinking about it from a very broad standpoint of health includes wellness by definition. You don't see that with some of our other generations in the workforce. They have a more traditional view of what health is. Let me give you one more example of something that we've seen in our research. That's a difference between Gen Z, for example, and some of the other generations. Our Gen Z employees, especially those that are under the age of 26, about half of them in the workforce, they're on their parents' health plan. So they're not really paying attention. And we see this from our surveys. They're not really paying attention to their own health plan at where they work because they're getting it from their parents and their health plan. Interestingly enough, they're also not paying attention as much or as familiar with all the other benefits at their workplace, even if they have access to them. So we see this kind of gap between those that are getting their benefits through their parents versus those that are getting their benefits through their employees. And what some employers are starting to do because of that is they're actually starting to do a second onboarding. They're identifying employees that are age 25 that are not on their health plan. And they're already starting to communicate with them saying, next year, you're probably going to be joining our health plan. Let's reacquaint you with what we have here for you. Let's get you engaged. Let's get you involved. So that's just another example of why it's so important to think about all of those kind of subcategories of your employees, whether it's demographics, caregiving, health status, whatever it is. It's important so you can better personalize, you can better communicate, and you can better engage with those employees.
As the generational shifts evolve, as you mentioned, there are different things that younger workforces broadly consider healthcare, right? There's a whole conversation to be had about investing in mental health as a preventative benefit, rather than just, as you mentioned, in a very old traditional sense. Healthcare was you get sick, you go to the doctor, you may go to the hospital, and that's sort of where it ends as transactional. When we think about these things from the employer perspective, or broadly speaking, and I don't can't get too overall here, are these additive costs or are they replacement costs? Are people adding to the list of things that they are expecting from an employer-generated healthcare benefit, or it's saying, hey, I don't need something that's not relevant to me anymore? So rather, I would rather get, for example, access to a, an on-demand telehealth, operation or something like that.
Well, I think the way I would look at it is to say, in some ways they can be replacement costs. And what I mean by replacement, though, is not necessarily a one for one. It's actually replacing preventative care with something that might be more expensive down the line. And the way I always look at it is I go back to the data. And our surveys show about 41% of consumers with employer-based insurance say that either they or someone in their household has a diagnosed mental health condition. 41% are telling us that in our surveys. So we know, for example, that mental health is a big issue out there. And you brought that up rightly, Jerry. It's an important issue out there for employers to think about and for others to think about. Now, here's the cost side of that, is that we also know from the research that those with a mental health condition and almost any other type of comorbidity, they've got a mental health condition, maybe they have diabetes, maybe they have COPD, whatever it may be, it's about a 3x cost difference. So there's something about when you have a mental health condition, it does make it harder often to manage a chronic condition, for example. Go to those doctor's visits, do that testing, take the medication, participate in an ongoing program. So when we start to unpack that a little bit, we start to really see what's driving the costs. And now if I'm a benefit leader and I'm having a conversation with the CFO about how do we tackle some of those costs, well, it very well may be an additive program. You may be adding a new mental health benefit that maybe you didn't have before because you want your employees to have more access. You want them to have that virtual access. Frankly, you just want them to have access at all. We know that it's tough to sometimes get a mental health visit. It's tough to get a psychiatry visit. It's incredibly tough on the pediatric side. So for your employees that have dependents, getting their visits. So maybe adding that benefit and adding that cost to get that benefit changes the balance around access and actually can start to reduce overall costs as we think about that interplay between, for example, mental health and chronic conditions.
There's a big topic that's been gaining traction in some circles. For others, it's just been the way of life. And it's this concept of food as medicine. There have been studies from folks who eat different lifestyle or different, diets that say, hey, if you eat the way that I do, there are studies that say you will not get sick. You will have, benefits that not just, in the immediate health, but in the long run. Tell us about that for folks who may not be as familiar. Is it one particular ideology or a lifestyle, and how do we think about food as medicine in terms of the healthcare investments and the benefit side?
Well, you're speaking my language, first of all. This is a topic near and dear to my heart, and during our research around this, I would say the whole team was just so engaged because it's such a fascinating topic, and I think you're bringing up the right question. What's really encapsulated in this concept as food as medicine? Look, in some ways, it's a topic that it's old as time itself, right? I mean, this we've all heard the different sayings. You are what you eat. Be careful what you put in your body. Food is what powers you. Well, the reality, we've had a resurgence and focus on this, and it actually started, several decades ago in the world of healthcare itself. We saw, especially over the last 10 years, a lot of focus on what some people call the social determinants of health. This concept that actually the biggest influencers of our health are not our doctors and hospitals that we interact with, but it's actually what happens in our household. It's what happens when, with our access to exercise. It's around what happens with our access to food. So we have to kind of think bigger than a health system in health interactions. And we have to think about kind of our total 360-degree view of our lives. And by the way, food is a huge part of that. And we are very much influenced by that. So now we see things like physicians actually writing prescriptions for healthy food, for example. We've seen a resurgence in looking, having transparency around food labels. We see primary care teams now adding dietitians and nutritionists to the care teams themselves because they know it's incredibly important. I want to bring it back to the employer on this. We asked employees about their access to healthy food. And why would we ask that? Because the reality is you spend a lot of your time at work every day. You're getting a lot of your meals in and around your workplace and food in and around your workplace every day. Only 38% of employees told us that they have access to healthy, affordable food at work. We knew we had to do something. This was something we needed to research.
For a period of my life, I went full vegan. It was a good, a reset for my body. And then the pandemic happened and we decided, hey, it's a lot. Can't cook three different things, right? For the kids and for me and for other folks in the house. And so, I agree. And I do think that, there's research that backs it up. And obviously, I think the tough part is it's really hard to, much of healthcare is in what things people can measure, right? And so you're taking X of this medicine from a baseline, where you're going, and so I think these conversations are ongoing. Another hot topic in healthcare as it relates to both people's well-being, health, and the employer or just broad cost side is the introduction of GLP-1s. They go by a variety of different brand names. They were initially introduced as things to help with people's cardiovascular health, with blood glucose management, but it's also been known to help with weight loss. And so there's a lot of folks who are taking it and losing weight as a result of it. Employers and companies are reacting to that in different ways. By and large, obviously, when folks lose weight, there could be a health benefit for a large part. And so how does that part contribute to the conversations that you were having with benefits leaders in terms of, is that something to invest in? Are we taking guidance from the government agencies in terms of what's allowed, what's not allowed? It is something that I believe that is, often talked about in benefit circles. Tell us, Ben, what you're hearing out in the marketplace.
Well, I tell you one thing that we did do on this particular topic in the around GLP-1s, also this topic in general, is we went out and we surveyed physicians to really get an understanding of how they're looking at this. I
Mm,
mean, these are the doctors and nurses, both on the primary care side and on the specialty care side, that are really taking care of our employees on a day-to-day basis. There's a couple of things we heard from our specialty clinicians. One of the barriers that they see out there, by the way, 70% of specialty clinicians we surveyed said it's the unaffordability of healthy food. It's a lack of knowledge about healthy lifestyle habits. Now, the clinicians, of course, realize that, yes, there are companies now that are covering GLP-1s for not just diabetes, but for that expanded use around general weight loss. But over half of specialty clinicians that we surveyed said that employees need targeted support for those going
mm,
through weight reduction programs. That using a GLP-1, it can be an effective strategy, but it's more than that. You have to have wraparound services. You have to provide education around nutrition. You have to provide education about how to access nutrition. And you don't want to leave it as just a drug only intervention, because for many of the clinicians that we spoke to, and by the way, many of the benefit leaders that I'm hearing from, they're all saying the same thing, that people staying on these drugs can sometimes wax and wane. And certainly when they come off of them, if they haven't had that support, if they haven't had that education, then often the weight comes back, and all
mm.
that that was invested before in the drug itself didn't seem to pan out the way they thought it would. So we've got the doctors themselves saying you need to have this target to support for employees. More than half were saying that. When we asked employers what they're doing, we only found about 14% of organizations are offering this more holistic support above and beyond just the drug intervention itself.
We've talked a lot today, Ben, about a variety of different healthcare concerns and how it impacts a variety of different groups within employer circles and also on the employee base. What strategies are working today for clients and for folks that are leading in this category to help address effectively the vast diversity and the different categories of folks who need all types of different care? And yet you can't just say, hey, here's one blanket policy or one blanket system. How does that work? And then how do we make sure that everybody feels included in this conversation?
Well, I think that's a great question. I remember when we kind of kicked this off, I said, there's some strategic things to think about. There's some tactical things to think about. I'll stick kind of at a medium level for right now. What are some things that are kind of what I would say at the programmatic level? I've also got some more specific, almost case studies that I can talk about a little bit. But at the programmatic level, one of the things that we saw is, many employers are thinking about things like healthy food options, in the company, right? If you have a company cafeteria, company break rooms, wherever you have options for healthy food, we see a little bit over a third of benefit leaders are saying we're doing that. By the way, over 60% of doctors said that's a very important benefit to have in the workplace. You need to have healthy food options in your company cafeteria. You need to have healthy food options in the break rooms. Now, here's what I hear a lot from benefit leaders. They say, we've tried that and no one wants the healthy food. So there's another kind of part to the story out there. And what we think that part to the story that's missing is financial incentives. In fact, we think financial incentives for healthier eating are actually pretty anemic right now. In fact, only 13% of benefit leaders said that they do some sort of financial incentive for their on-site food. We talked to dietitians and nutritionists who actually run corporate food services, and they all said they had the same experience. When a company makes a healthy food the cheaper option, of course, it's still got to be tasty, but make it the cheaper option, you really start to see the benefit from something like that. So you want to kind of create the easy button, if you will, for employees around these options. And part of the way that you're making it easy for them and you're reducing friction to have that is you're doing some differential pricing, whether that's raising the price on the non-healthy food, lowering the price on the healthy food, or doing some sort of balance in between. You want to try to reduce that friction. So that's a really, really important thing. On the clinician side, 60% said that would be very important to do, that employers should look at that, have a wellness incentive that's tied to some of this as well.
This conversation leads us to another topic that is often talked about, which is how do you get the employees on board, right? Why are you taking such an interest in my personal health? This is just work. You're monitoring what I eat. You're monitoring when I go to the gym. In some cases, there's incentives. There certainly can feel, so folks can feel pressure of oversight of, hey, you're getting too much into, how I live my life, and a resistance almost to want to share things, or, I guess broadly to speak, the willingness of the employee base to want to participate in all the offerings, right? And so, the doctors and the research can say, hey, this is good for us. This is going to be good for you and for me. And the employees might say, that's cool, but I'm still going to eat my bacon double cheeseburger, and French fries every day because that's what I like. And so how do we have this conversation in an effective, inclusive, and also, a healthy way, pun intended, to make sure that, we're not feeling that we don't feel combative when we introduce new ideas, and then to make sure that the employees don't feel like this is something that is A versus B, but rather something where we all benefit from making these changes.
Well, I think that's a really excellent point. You don't want any of this to be a barrier. I'll start with just a couple of things I'd sprinkle in just in terms of what's the state of our employee population now in terms of what they're doing around dietary health. So we have about 52% say, I'm eating nutritious foods, fruits, vegetables, low-fat proteins. 40% of employees say, I'm even willing to pay more for healthier foods at the grocery store. A little bit over a third say, I'm already tracking healthy eating habits now. 28% are saying, I'm discussing eating habits with my doctors, nurses, or a nutritionist or a dietitian. I'm getting some sort of input around that. I only wanted to throw those percentages out there to say, listen, we've got a base to work with. We have an employee population that's showing interest in this. They're actually taking action. So then it becomes like, how can we increase that? How can we spread the word? I think there's a couple of ways to do that. I think you were alluding to a really important thing. Is this going to be a choice? Or are we going to force our employees to do something? I think the smart employers are really thinking about this as a choice. Now, the second part of this is, can you make it a painless choice, right? And I think that's where you start to get into things like differential pricing, wellness incentives. Can you kind of sweeten the pot, if you will, on making it more of a painless choice for them? I think the second thing is we have a lot of opportunity with our employees now regarding our primary care strategy. So many employers already have a virtual primary care option, or maybe an employer that has an on-site clinic or a near-site clinic. There's some opportunities there to make sure that the primary care interaction actually includes a real nutrition, diet focused input to them. A lot of primary care physicians would try to do that now. A lot of times they don't have enough time. Sometimes they don't have enough expertise, and they would like to have a dietitian or nutritionist on the care team to help with that. So I think that's some of the ways you kind of get away a little bit from kind of like the creepy factor, or, like, you're in my business and I want you to be in my business, or aren't you just forcing me to do something? You're doing it in a way where you're building off of the employee base that already wants this. Can you expand that? Can you reduce the friction? Can you involve the primary care system in that, because people trust their doctors, and that's real important to them. And then the last thing I would just mention, and this is what we heard on several occasions, is that if you can get employees to talk to employees, you may have an employee resource group, you may have employee champions. They certainly trust their fellow employees who might say, hey, I've enrolled in this program, or, hey, I'm, only going to the green dot food in the company cafeteria, and here's what my results have been, that can go a long way as well.
As with all things, good things and new things take time for folks to get acclimated to have it be, hey, maybe ask down the line, why wasn't this always the way? Right. And so just in the ways that perhaps we've talked about mental health in different ways, and now it's becoming, and as you mentioned, and as we all know, that the younger generations are now seeing this almost as a necessity of why aren't we talking about this as a part of our healthcare? What are some of the trends that you're seeing now that will be the norm, that you think will be the norm in 5 to 10 years? And I want to share, I want to ask this sort of under the, the broad understanding of the various policy changes that are happening in our country. And so I just want to make sure that this is healthcare focused, and to make sure that, employers and employees obviously are prioritizing their both physical, mental, emotional health. What are some things that we are going to look back 5 to 10 years from now and saying, man, I'm glad we did that. I'm glad that we prioritized that. Or obviously hey, why didn't we do this sooner?
Well, I think there'll be a lot of why didn't we do this sooner? I mean, one thing is, I think as employers, we've been flying blind in many cases, right? We don't have the data to know how our employees are doing vis-a-vis wellness, certainly vis-a-vis nutrition. So I think 10 years from now, if we see this continued development of better data analytics, using claims data, surveying our employees, what are their challenges around any of these social determinants of health, including wellness, including food and nutrition, bringing all of that data together to really better customize a message. Who needs what? I mean, obviously, that's the important part of this is, can we customize this? So it's not just always a blanket message, and people feel like it's more personalized. So I think I'd put that in a category, one example of something I think 10 years from now, we'll look back on and just say like, wow, why weren't we doing that sooner? Really using our data to understand what our employees need, customizing and personalizing the intervention for them. I think that will be one issue we'll certainly look at. I mean, I think the second thing is, we'll look back on the kind of, why didn't we do this sooner? I think many times as employers, we tend to forget all of the ways that we are providing access to food for our employees. I mean, there's the break room, the floor, the convenience, kind of the convenience food that's there and that our employees have access to. There's the celebrations. There's the offsites where we're meeting at restaurants, or we're going to an offsite meeting at a hotel where food is being provided. There's the company cafeteria. There are so many ways that employers are already providing food and nutrition. And I think not leaving that on the table of why didn't I provide more healthy options? And I'll give you one example. And I heard this from an employer I was talking to recently that said, well, we do a breakfast sometimes for our employees, and we bring in donuts and then we bring in oranges, and the donuts always get taken and the oranges are always sitting there. I thought this is a perfect analogy of friction. A donut, you can just pick up and you start eating it immediately. And an orange, someone has to, peel and, figure out where they're gonna put the peels. And then they, their hands might get sticky and things like that. And so I think we have to kind of get into those details of, can you make fruit and vegetables in a bite-size, easy to take method that's just as easy as grabbing, something that, maybe is a little bit less healthy that you should have less of, like a donut. So, there's some things that I think we're leaving on the table that we will look back on and say, gosh, we actually could have done something around some of that food that's on site. So data is a big one. The analysis, understanding who needs what. I think, using the opportunities that you have with the food that you're already providing. And I think there's a third category I would throw out there, which is, what are we going to do in terms of innovation? And I see some employers are doing things like, we provide a lifestyle spending account. Well, part of what you can buy with that is, food, meal packages delivered to the home, healthy food boxes delivered to the home. I talked to one organization that has an on-site cafeteria. They're actually doing now packaged nutritious food that employees can buy. These are basically family dinners that they can buy and take home with them to their family back home just to heat up and eat. What they realized was when people are short of time, a lot of times, it's the fast food option in the drive-through that's on the way home to feed their family. Why not give them access to healthy food that they can already be taking home, stick in the oven, give their family a nutritious dinner with zero friction to make it happen? So thinking about innovation in those areas, I think will also be quite important.
Our Tomorrowist audience might have wondered, did we really get through a whole episode without talking about AI? So we will not let that happen. And I have a very AI specific question as it relates to our topic today, Ben, which is, a lot of folks are going to ChatGPT and other platforms to ask questions, including healthcare questions. There are a lot of concerns around the truth behind that, the recommendations that a computer will generate, and how much credence an individual should take, particularly when it comes to their health. This does play in how people are diagnosing themselves or asking healthcare questions. And it does give a lot of practitioners some concern about going to the source. Of course, we understand the ease of opening up your browser or your phone and typing or even talking to it. And we just assume that because it's smart, or we think it's smart, we've been told it's smart, that it's going to give us proper information. What are some things that business leaders, healthcare leaders, and benefits leaders should be mindful of, as we know that this is just going to be a human trend that is probably going to even more accelerate in making sure that our employees and our communities are being given the right information, and so that we can package our benefits and package our healthcare plans around doing what's best for everybody?
Well, it's an excellent question because, by the way, this is a bit of an age-old question as well. I mean, right now we hear a lot about it in the framework of AI, but if we went back 20 years ago, it was in the framework of just the internet in general.
Or you ask your uncle.
Right. Used to hear doctors talk about, yes, I have a patient coming in, they're internet positive, meaning that they have looked online and they're coming to me with what they think their issue is. I would look at it a different way and say, here's an opportunity for employees to get engaged in the health benefits that you're investing in for them. Here's an opportunity for your employees to get engaged with the health system that you're paying for them. And regardless of what helps to get someone engaged, whether they did an AI inquiry or just a regular internet search, or they were talking to a friend or a coworker, all those paths ultimately should lead to the health benefits ecosystem and the health system. And it provides another opportunity to engage in wellness programs, to engage with your primary care provider in your care team, to engage with telehealth, nurse hotlines, virtual health. Ultimately, I think we want to turn some of these challenges, which could very well be challenges, into a positive, to say, regardless of what got you, interested, and where you found information, let's take that to your professional health provider and some of the benefits that we've provided for you, to make sure that you get the overall best information with someone who knows your medical record, knows your history, and you can have that deeper conversation with.
Excellent. We've talked a lot today, and I've learned so much, and I hope that our audience has as well. Of all the things that we shared about today, Ben, if there's one thing that our audience can take away as a takeaway or a go-to to make sure that they can read more upon it or begin a conversation within their workplaces to focus on to bring more health and more access to healthcare, positive healthcare to the organization, what is that one thing?
Well, I would say there's one thing that you can always start with, and that is, I think a lot of benefit leaders, you're already providing some benefits that can help with this. And so why don't you get the most out of it? So we
Mm.
always say the low-hanging fruit is around engagement. You may already have a wellness program. You may already be providing some healthy food in the workplace. Go ahead and double down on that engagement and see if you can increase the use of it. And then you can see, where do I want to expand next? I think that's always the way to go. Get more from the dollar you're already spending.
Ben, thank you so much for your time today. It's been a pleasure. I learned a lot. I hope our audience has learned a lot. And thank you for making sure that we can all stay healthy.
Thank you, Jerry. It was a pleasure to be here.
That'll do it for this week's episode. If this conversation resonated with you, check out the show notes for additional resources to help your organization prepare for what's ahead. See you next time on Tomorrowist. If you enjoyed today's conversation, please subscribe to Tomorrowist wherever you get your podcasts. We also publish a weekly newsletter with in-depth articles and the latest SHRM research to help keep you in the know about the trends shaping the future of work. You can subscribe and find all of our episodes on our website at shrm.org/Tomorrowist. Thanks for listening. And remember, the workplace is changing rapidly. You don't have to be a futurist, be a tomorrowist.
SHRM.